Welcome back, guys. Now let's continue with the topic of alveolar ventilation and pulmonary circulation. Students, first tell me the meaning of the word ventilation. Ventilation means what? The amount of air that you are taking in and taking out. Okay. So ventilation, we are always talking about the air related thing. Means how much air is going into the lungs every minute. Next, what about the circulation? Circulation means what? How much blood is going. So simple. In this topic of alveolar ventilation, pulmonary circulation, we are mainly concentrating on how much air is going into the alveolus for the purpose of oxygenating the blood, and how much blood is coming. Okay, how much air is going and how much blood is coming. So now tell me, how much air do you think will go to the alveolus every minute? 1 liter, 2 liter, 5 liter, 6 liter, 10 liter. How much air is going? I am not talking about the oxygen. How much air is going into the alveolus every minute? Do you have any idea? No. And how much blood is going to the alveolus? How much blood is going to the lungs every minute for the purpose of gas exchange? We don't know. See, so that's what we are going to do now. Guys, alveolar ventilation representing with the word V. Alveolar ventilation means what? Air going into the alveoli. Okay, not just the lung, air going up to the alveoli for the purpose of gases exchange. And what about the pulmonary circulation represented with the letter Q? That is blood going to the lungs for the oxygenation. How much air is going and how much blood is coming. So, okay. Now, guys, one thing is very easy. It is pulmonary circulation. How much blood is going to the lungs? We all know every minute, almost 5 liters of blood will go to the lungs every minute. From the right side of the heart, every minute 5 liters of the blood is going to the lungs and getting oxygenated, and the 5 liters will come to the left side of the heart and goes out as cardiac output. So every minute how much blood is going to the lungs? Almost 5 liters of blood is going to the lungs every minute. Okay. Now let's talk about the ventilation first. After discussing about the ventilation, later let's discuss about the circulation. First, begin our topic with the minute ventilation. Okay, every minute how much ventilation is happening? Minute ventilation. Guys, don't confuse it with the alveolar ventilation. Minute ventilation is different, alveolar ventilation is different. First, let's see what is minute ventilation, later calculate alveolar ventilation. So, minute ventilation, what it is? Sir, minute ventilation means tidal volume. Okay, tidal volume, TV, tidal volume into respiratory rate. How much is your tidal volume? Tell me, guys. Tidal volumes are 500 ml, means with every breath you are taking 500 ml of air into your lungs. And how many times you are breathing in a minute? Respiratory rate means how many times you are breathing in a minute. How many times? 12 times, let's say. Okay, 12 times, 12 to 16 times. So minimum let's say 12 times. So how much air you are taking into the lungs every minute? You are breathing 12 times, and every time you are taking 500 ml. So 5 into 12, how much? 6000 ml. Okay, per minute. So now tell me, how much air you are taking into the lungs every minute? 1000 ml of air, almost 6 liters of air you are taking every minute. But here there is a small loop, okay, small thing. Do you think this 6 liters is going to the alveolus? No, the 6 liters is not going to the alveolus, because there is something called as a conducting zone where some air is always left over. There is a dead space, okay, conducting zone. So what I am trying to say, when you take 500, don't think that the 500 is going up till to the alveolus. Don't think the 500 ml of air is going to the respiratory zone. Some air is always present in the conducting zone. No, some air is always present. So now, see, out of this tidal volume 500 ml, okay, out of the tidal volume, that is 500 ml, sir, 150 ml, okay, 150 ml is every time lost in the dead space. Okay, 150 ml, it's a dead space. Okay, 150 ml is a dead space. Now, let's look. Every time how much you are losing? 500 ml of 150 ml of air you are losing in the dead space. Wasted. Out of the 500, 150 is wasted in the conducting zone or dead space. So, how many times you are wasting? 12 times you are wasting. So, 150 into 12. 150 into 12. How much? 150 into 12. So, 150 into 12. It's somewhere around 1800 ml. 1800 ml is your dead space ventilation. Means this air is lost in the dead space, not involved in gases exchange. It's waste, no use, because it's not getting exchanged. Then what about the remaining amount? Sir, out of this 500, 150 is gone, wasted in the dead space. Then how much actually reached your respiratory zone? See, I have taken 500. In this 500, 150 is present in the conducting zone. Then how much actually has gone to the respiratory zone or to the alveolus? That is 350 ml. So this is the actual value, guys. The amount of air that you are taking into your alveolus is actually not 500, it's only 350. So 350 you are taking every time, and 350 into 12 times. Okay, 350 into 12 times you are breathing. So tell me 350 into 12 how much? the value will be somewhere around 4200 ml. Okay, 4200 ml is your actual alveolar ventilation. So congratulations guys, you have calculated the alveolar ventilation. Now you know how much air has actually gone to the alveolus for the purpose of oxygenation. So now tell me, what is your alveolar ventilation value? The alveolar ventilation value is 4200 ml per minute. So this much amount of air is going to the alveolus. And how much is your pulmonary circulation? Pulmonary circulation Q value is 5 liters. So now you know what is the alveolar ventilation? 4.2 liters, 4.2 liters. And how much is the pulmonary circulation? 5 liters, 5 liters. So yes, now you know both the things. Then how the question is going to come up in your exam? Okay, let me give you more clarity. Sir, you are true, you are taking 6 liters of air into the lungs. You are taking 6 liters of air. But in this 6 liters, okay, in this 6 liters, 1800 ml, okay, 1800 ml or 1.8 liters. 1800 ml is the DSV, that's the dead space ventilation. 4200 ml is your alveolar ventilation. Okay, alveolar ventilation. So very simple, right? Tell me, 1800 plus 4200, how much? 6000. 18 plus 42. Okay, how much? 60, 6000 ml. So yes, you are taking 6 liters, true, you are taking 6 liters, but in the 6 liters, 1800 ml is lost in the dead space. Only 4200 ml has gone to the alveolus. Okay. Now, how the question is going to show up in your exam? How the question will come? See, take the question here. Okay, question. Question is, let's say there is a patient whose respiratory rate 12 times per minute, his tidal volume, let's say same 500 ml per minute. Okay, his anatomical dead space or conducting zone, let's say 200 ml. Okay, 200 ml. Now I am increasing the anatomical dead space. Now calculate and tell me what is the dead space ventilation and alveolar ventilation. How much is his dead space ventilation and alveolar ventilation? Very simple. Sir, how much air he is taking every time? 500. In this 500, how much is wasted in the dead space? Sir, in the dead space, 200 ml is wasted every time. So out of 500, in this 500, 200 is gone. Every time 200 is gone. So dead space ventilation is 200 is lost every time into 12 times. Okay. Next, how much is actually going to the alveolus? 300 is actually going to the alveolus. 500 में 200 gone. In the out of 500, 200 is gone. So 300 is left over. 300 into 12. So tell me guys, 200 into 12 how much? It's going to be 12 twos. 2400 ml is your dead space ventilation. And how much is the alveolar ventilation? The alveolar ventilation in this condition, let's say it is 3600 ml. Okay. So this is how to calculate how much is the alveolar ventilation, how much is the dead space ventilation. Okay, if you add these two, if you add the dead space ventilation and alveolar ventilation, the value, how much value it will be? That will be minute ventilation. That will be minute ventilation. So how much is the minute ventilation in this condition? 6 liters. Okay, minute ventilation is 6 liters. That's it. So always remember, when you add the minute ventilation, see, when you add the alveolar ventilation and dead space ventilation, you will be ending up with minute ventilation. Done. Now let's see a few more points regarding the dead space. Important points about the dead space. These are just single liners. We all know, sir, anatomical dead space is nothing but the conducting zone. Anatomical dead space is nothing but the conducting zone. Which generation? Generation number, the first 17 generation number 0 to 17. And how much is the value of this anatomical dead space? Normal individual, in normal individual it will be 150 ml. The conducting zone is 150 ml. And how much is the alveolar dead space in a healthy individual? Is there anything called as the alveolar dead space? No, there is no such thing as alveolar dead space. Always blood will go to the alveolus. Okay, there is no such thing as alveolar dead space. Yes, blood is going to the alveolus. So in a normal individual, alveolar dead space is always 0. So now how much is the anatomical dead space guys? 150 ml. And how much is the alveolar dead space? There is no such thing as alveolar dead space. It's always 0 ml. Okay, then what is the physiological dead space? If you add both anatomical dead space and physiological dead space in a person, then it will tell you the physiological dead space. Okay, anatomical plus alveolar, sorry, anatomical and alveolar dead space addition will tell you the physiological dead space. So anatomical dead space, how much? We all know the anatomical dead space is nothing but the conducting zone, 150 ml. And how much is the alveolar dead space? There is no alveolar dead space in a healthy individual. So 0, 150 plus 0, how much? 150 ml. So we can say in a healthy individual, anatomical dead space and physiological dead space value is equal. So that's what I am showing you here. In a healthy person, the physiological dead space is equal to the anatomical dead space. Okay, physiological, anatomical is equal, and always alveolar is 0. Alveolar dead space is 0. Now, what are the different methods? Okay, these are just single liner questions which I wanted to know. What are the different methods which are used to calculate the anatomical dead space. Okay, the measurement of anatomical dead space. What are the methods used? See, there is a method called as Fowler's method. Fowler's method. Other methods are also there. Fowler's method. Okay. Next, physiological dead space. It is measured by. Okay, physiological dead space is calculated by or measured by an equation called as Bohr's equation. Okay, Bohr's equation. So how to remember this? Very simple. Let me give you a mnemonic kind of thing. So anatomy is what kind of subject, guys? Anatomy is like, you know, foul smelling subject, right? It's all full of bad smell, foul smell. Okay, anatomy labs. So always remember, anatomical dead space is measured by a Fowler's method. Anatomy for foul smelling. Okay, and what kind of subject is physiology? Physiology is with a lot of like concepts, like too much more mind-boggling things are coming. Okay, so usually students will feel like it's a boring subject. So physiological dead space, boring. Okay, physiology for boring, anatomy for foul. Okay, in first year MBBS, people will feel like that. Physiology is all boring, anatomy is all foul smelling. Okay, so anatomy, foul smelling, physiology, boring. So with this, what we have completed? We have completed the topic of what is a normal ventilation and what is a normal perfusion, and how to calculate the anatomical, how to calculate alveolar ventilation and dead space ventilation. So with this, the topic is completed. In the next videos, we will be discussing more about the perfusion. Okay, we will be discussing more about the perfusion and ventilation perfusion mismatches. Hope the video is helpful. Thank you.